So we have the ascending tracts and the descending tracts. The ascending tracts are also called as the sensory tracts and the descending tracts are called as the motor tracts. Under ascending tracts we have three: spinothalamic tract, spinocerebellar tract and the posterior column. Under spinothalamic tract we have the ventral spinothalamic tract and the lateral spinothalamic tract. The ventral spinothalamic tract is responsible for controlling light touch and crude touch, whereas the lateral spinothalamic tract controls pain and temperature. Now let's move to the spinocerebellar tract. The spinocerebellar tract controls balance and coordination. Thirdly, we have the posterior column. The posterior column has two parts: fasciculus gracilis and fasciculus cuneatus. This posterior column is also called as the dorsal column medial lemniscus. It is called as dorsal column medial lemniscus. This posterior column controls pressure, vibration, stereognosis, tactile localization and tactile discrimination. Vibration means whenever we apply a vibrating tunic fork over the bony prominences. Stereognosis is whenever you ask the patient to close the eyes and you give them an object in their hands and the patient needs to identify the object. Tactile localization is once again the patient closes his or her eyes and you apply a cotton swab or you apply a pin prick to different areas of the body and the patient needs to identify where it is applied. Tactile discrimination means the patient needs to identify whether the applied object is a 2-point or a 1-point. Now let's talk about the descending tracts, which are also called as the motor tracts. These descending tracts are divided into two types: pyramidal tracts and the extrapyramidal tracts. In the pyramidal tracts, we have the corticospinal tract, and in the extrapyramidal tracts, we have the vestibulospinal tract, the rubrospinal tract, the olivospinal tract, and the tactospinal tract. Now these corticospinal tracts are divided into ventral and the lateral corticospinal. The ventral one is responsible for controlling bilateral postural movements and the lateral one controls fine finger movements. Now let's talk about the pain pathway, also called as the pain gate theory, and then we'll talk about the pressure pathway. Before beginning with the pain pathway or the pressure pathway, one thing you need to remember is that the pain pathway is controlled by the lateral spinothalamic tract and the pressure pathway is controlled by the posterior column, also called as the dorsal column medial lemniscus or called as the dorsal column medial lemniscus pathway. So the pain pathway or the pain gate theory. Here, the first order neuron carries the nociceptive stimuli from the skin to the dorsal root of the spinal cord. Here it synapses with the second order neuron in the substantia gelatinosa. Now it crosses over the lateral spinothalamic tract. From here, it moves and it synapses with the third order neuron in the thalamus. Now the third order neuron in the thalamus finally carries the sensations from the thalamus to the cortex or to the limbic system. Important note to remember over here is that the substantia gelatinosa, it has an inhibitory effect on the second order neurons. This is also called as the presynaptic inhibition. However, if the gate also receives impulses from the thermoreceptors, which are the heat receptors, it predominates this presynaptic inhibition and the pain gate opens. Now let's talk about the pressure pathway. It is controlled by the posterior column or the dorsal column medial lemniscus. Therefore, it is also called as the dorsal column medial lemniscus pathway. It is almost similar to the pain pathway, however, there are few differences. So, the first order neuron carries the pressure sensations from the skin to the dorsal root of the spinal cord. This dorsal root of spinal cord is the same as the posterior column, that is divided into fasciculus cuneatus and fasciculus gracilis as discussed earlier. This fasciculus cuneatus takes the sensations from the upper limb and the fasciculus gracilis takes the sensations from the lower limb. Here it synapses with the second order neuron in the medulla oblongata. Now this second order neuron synapses with the third order neuron in the nuclei of the thalamus, and finally the third order neuron carries it to the cerebral cortex or to the limbic system. Now let's make it simpler. The pain pathway. So the first order neuron carries the sensations from the skin or from the nociceptive stimuli to the dorsal root of the spinal cord, where it synapses with the second order neurons. Now the second order neurons cross over into the lateral spinothalamic tract. From here it directly moves into the nuclei of the thalamus, where it synapses with the third order neurons. Now the third order neurons take the sensation directly to the limbic system or to the cortex. Now the only distinguishing feature in the pain pathway and the pressure pathway is that the first order neurons are going to synapse with the second order neurons in the medulla oblongata. So let's see the pressure pathway. Pressure pathway, first order neuron from the skin to the dorsal column medial lemniscus, also called as the posterior column, synapses with the second order neuron where? In the medulla oblongata. From the medulla oblongata, it takes the sensations directly to the nuclei of the thalamus, which is similar to the pain pathway. There it synapses with the third order neuron. Now the third order neuron takes the pressure sensations to the cortex or to the limbic system.